Hi, this is Laurie DeYoung from WPOC. You know, I've been talking to 3 generations of women on the radio, everything from silly topics to more serious things. And on that sensitive side, I have just learned some new things about women's personal health services at Chesapeake Urology. So come on, let's go find out some more. Many women associate the practice of urology with men's health, and oftentimes they don't realize why choosing a female urology specialist for pelvic health and female urological conditions is so important.
Women's health needs have been underserved for decades. Women have lots of problems from the waist down. They don't talk about it. They don't want other people to know about it. So what happens is this is a big hush-hush secret that everybody knows, but nobody wants to discuss. So patients don't know where to go. Chesapeake Urology has come to the forefront and created a women's personal health program. This is an effort to help women realize that these issues are important and they can be treated. Things like recurrent bladder infections, pelvic pain syndromes, prolapse, and incontinence. These topics are critical to quality of life. So what we're doing is creating a panel of expert doctors, both urologists, urogynecologists, and fellowship-trained urologists who are interested in treating this area and helping these people.
Chesapeake Urology's team of specialists focus on women's most personal health care issues, providing the focused and expert care needed for specific women's urologic conditions. Well, I know what you're thinking. Why wouldn't I just go to my gynecologist or my general practitioner? I'm not going to answer that, but Dr. Lisa Hawes, she will.
The problem is, with the squeeze in healthcare lately, doctors are seeing more patients every hour. And so you get your 10 minutes with a physician and you don't have time. Incontinence is the last thing on the list. First thing, it's high blood pressure, then it's diabetes, and then it's weight. And oh, by the way, the doctor's on the way out the door and I want to talk about my incontinence, which is already a personal issue and something that is difficult to broach.
We're talking about a woman's quality of life, and it may be something that they feel very uncomfortable in general talking about with their family doctor or with a physician that they don't know well.
Dr. Kelly Johnson recently completed a fellowship in women's urology and neurourology and has been with Chesapeake Urology since August.
Our approach is that we want women to come in and feel very comfortable talking about things that are personal, private, and intimate, parts of the symptoms that they're experiencing, that they feel that they can relate to us, that we understand, and we get to know them very well and learn what their most bothersome symptoms are and how to treat that.
Chesapeake Urology is the only women's urologic health program in this area that's dedicated to caring for women's most intimate healthcare needs. And they understand those needs are very different than a man's.
Women patients are very different than male patients. I mean, a lot of male patients come in, they want a simple solution to their problem. They want a pill, they want one thing that's going to fix them and just get back to their life. Women, when they're talking about intimate and personal problems like people experience in female urology with leakage of urine or chronic pelvic pain, women want to feel that they have a doctor that listens to them, that is able to relate to the problem that they have. And women want to get to know that doctor and feel that they really care about their problem and know how to fix it.
The patient experience at Chesapeake Urology has been developed to provide an environment where women are comfortable and feel the type of privacy that's so important to us.
They don't want to feel like they're being treated like everybody else. They want to feel like they have a physician that takes the time, gets to know them, and really learns what their most bothersome symptom is and is there to treat it, and that we have every capability to do so, and we're not going to have to send them to multiple doctors. You're going to come there and we're going to be able to diagnose a problem, treat a problem, and you're going to leave there feeling comfortable.
The Women's Personal Health Care team realizes that we need more than just the most advanced care. Women need a personal experience.
The treatment plan depends and is very personalized for each patient. So sometimes it might involve a medication, sometimes it might involve a minor surgical procedure. For patients with incontinence, there are several medicines that are helpful. There's also physical therapy. We have very specialized pelvic floor physical therapists who work with patients to strengthen their pelvic floor and to work on those muscles that can help them prevent leakage that they're experiencing. And also patients with painful intercourse to learn to relax those muscles.
I don't know about you, but I really appreciate having a woman doctor when I'm talking about personal things. At Chesapeake Urology, they've come to understand that a lot of us feel that way. Comfort and privacy are very important when talking about these types of issues, but we also need someone who understands the emotional and physical impact of the condition.
Hello, this is Sue. Hi, how are you?
Sue Spurlock is a registered nurse and a patient navigator at Chesapeake Urology.
A patient needs a patient navigator because they need that individualized care and somebody that really will sit and talk with them, listen to them, and help them to understand what their diagnosis is all about, why the physician chose the treatment option that they have chosen, and sometimes there's more than one treatment option for that diagnosis, so you provide the educational assistance and the counseling to get that person to make the decision as to what treatment option would be best for them to have. A lot of patients on the initial phone call are very hesitant to talk to me in the beginning, but once I kind of go through my role and kind of ease their mind a little bit, they start to talk and they don't stop because they haven't had anyone to talk to about incontinence because it's an embarrassing subject. In my role, I think I give them that pathway to discuss what's going on with them, get them to the correct care provider that can help them. Then I'll review their office note and I'll go over the treatment plan, and then I will call them again just to review their diagnosis and explain the diagnosis and treatment plan that the physician has chosen, answer their questions, because a lot of times they may hear 30% of what the physician said, and out of that 30%, probably 75% is not really understood as it should be.
You have a nice afternoon. Bye-bye.
I think when a patient has a visit at one of our offices, I think that they feel very comfortable, and I think it's a very warm and caring environment. I think everybody that works for Chesapeake Urology loves their job, and I think that really presents itself when we present ourselves to a patient, and they get that sense of, wow, I just found the place I need to be taken care of, and they're going to take good care of me. And we do.
Chesapeake Urology's Women's Personal Health Program is specifically designed to meet the unique needs of women with a focus on exceptional care, overall well-being, compassion, and comfort. If you have any health issues you've been putting off, please give them a call. They want you to have the best quality of life possible, and so do I.